I'm standing in front of Ashley Regional Medical Center, a critical first response hospital where doctors and nurses save lives every day. What's said about the patient's safety in places like this matters, especially when it's used to shape statewide law. An emergency room physician, Dr. Stolworthy, was recruited by Senator Mike McKell to testify before the legislature in support of a kratom ban. The committee was told there had been an increase in kratom admissions over the last 4 to 6 months, mainly associated with withdrawal. In Georgia, an emergency room doctor told parents that a substance consumed by 5 middle school students who were hospitalized, in his professional opinion, the substance was likely kratom. But when those so-called kratom gummies were tested at the University of Florida, one of the nation's leading kratom research laboratories, tests for kratom and 116 other substances confirmed kratom was not present. To this day, the true cause of those kids getting sick is still unknown. But the rush to blame kratom before testing shows how wrong even well-intentioned medical assumptions can be. But that testimony did not establish that these cases involved natural kratom leaf products, but the fact that the chemically manipulated synthetic 7-OH could have been the actual cause of the person coming to the emergency room. Here's what Senator McKell doesn't want you to hear. Federal health leaders have clearly identified the real problem: a synthetic, chemically manipulated product falsely sold as kratom called 7-hydroxymitragene, or 7-OH. Senator McKell blames the kratom industry for deflecting blame to 7-OH. No HHS, FDA, and scientific research has done that conclusively.
7-OH is not just like an opioid. It does not just have opioid binding properties. 7-OH binds to the mu receptor, which means scientifically, by definition, it is an opioid. And yet it is sold in vape stores, in smoke shops, in convenience stores, and gas stations that are popping up all over the United States, and nobody knows what it is. But in reality, they are the concentrated synthetic potent form that is an opioid. If we talk about all 7-OH, then we're not distinguishing to the public the risk stratification of the synthetic concentrated from the trace amounts of 7-OH that naturally appear in the kratom leaf and have for centuries and have been used in teas and other things. So our scheduling recommendation will delineate trace amounts from synthetic concentrated amounts. We're not targeting the kratom leaf or ground up kratom. We are targeting the concentrated synthetic byproduct that is an opioid.
Senator McKell, if you can take a moment from your preening for the television cameras, tell Secretary Kennedy and tell Commissioner McCary that natural kratom leaf products are dangerous and killing people. They've put it on the record. 7-OH is the threat, not the natural kratom leaf.
They're going to tell you that the product 7-OH is the only problem. That's not what we're seeing happen.
Senator McKell dismisses anyone who says 7-OH is the problem. And this isn't hypothetical. We've already seen what happens when assumptions replace testing. That's exactly why legislative decisions should be based on verified toxicology and federal science, not fear, speculation, or mislabeling.